Some of the warning signs that you could potentially see in family members, friends, or even your children are a change in behaviors or a change in attitude. For example, a child may all of a sudden decide that they don't want to go to school anymore, or they may have unexplained stomach aches after the nurse continually says that they're okay. For some of our older adults, that could look like being more withdrawn and not wanting to attend social gatherings as well. For some of our teens, some of the same things do apply. If you see a teen or a teen in your family that's more withdrawn, isolating, not wanting to participate in family events, that could be a potential warning sign that they are experiencing some mental health changes or some emotional health changes. If someone has shared with you that they may be feeling suicidal, whether that's coming out and saying that they might be wanting to hurt themselves, or maybe saying, I don't want to be here anymore, there are resources to help. Number one, it's important that you share that it's okay to not be okay, and their mental health is part of their physical health. The best resource is the 988 New Crisis Statewide Contact. You can text that number or you can call that number, and then we'll get you connected to help immediately. And also stay with the person that you're with, whether that's friend or family member. Talk through some of why they may be feeling that way. And also explore outpatient services such as therapy or any kind of medication management that they may be willing to seek. Another great place to start is maybe with your primary care provider. Encourage them to speak with their doctor about how they're feeling. Reducing the stigma for mental health needs in our community continues to be a huge barrier for folks accessing treatment. If you have potentially experienced any mental health needs in the past, please share that with your friends and family. The more we talk about those issues and the more we talk about mental health with our friends, family, and community members, the more that we will see that stigma reduced. Remember, it is okay to not be okay. And also seek out resources such as your primary care provider. Talking with your friends, family members, or even children can be a daunting task when it comes to mental health. Maybe start by asking how they're feeling and let them know you've seen some changes in their behaviors. And it's okay if they don't want to answer right then, but you can let them know that you are a safe place to talk to, and again, provide them with resources in the community such as friends, family members, primary care providers, and let them know that you're always there for them if they want to talk. And let them know that you are a safe space and a safe place. A good place to start when asking for help or resources for your children or your family members or even yourself is your primary care provider or your child's pediatrician or your parent's primary care provider as well. They are very trained in answering questions and figuring out ways to get folks access to the help that you need. Another option would be to use your statewide database of the 211 through United Way. Another option that we mentioned is the crisis line is 988. You can also even Google outpatient mental health centers. Another option is the Tennessee Suicide Prevention Network. They are a statewide organization that offers resources such as gun locks and other safety materials for you to use in the home. Another great organization that we partner with is called the Jason Foundation. They have an app that has lists of talking points for parents and caregivers about signs to look for in their children and also their elderly family members.